for coming, and we're excited. We've got a two-part series on health navigation education in community colleges, and part one is today. And joining us for this, we have Dr. Richard Riegelman, who many of you are familiar with. He's been working with the project for since its inception, and he's a professor and founding dean at the Milken Institute School of Public Health at George Washington University. And we also are really excited to have Dr. Kate Johnson with us. She's a fairly recent graduate of the program at George Washington, and she's starting a new career in just a few days. So I'll let Dick talk a little bit more about that when we get to the part that she's going to be talking about. But she's got quite a lot of information that will be very helpful, particularly about the jobs that health navigation or health navigator certificates and degrees can get. So I'm going to turn the program over to Dick. As we've done in the past, we'll save the questions for the end. Just key them into the question section of the webinar, and we'll have that conversation at the end of the presentation. So Dick, you want to go ahead and start?
Thank you, Cynthia. I'm going to go over with you some of the academic programs design that's included in the Community College and Public Health reports. Many or all of you have that report, so I'm not going to go into the detail, but I want to give you the overview and then talk to you a little bit about the national statistics we have on the job market, and also then take a look at some of the issues about where things are going in terms of the forces at work in this complicated area. Then I'll turn it over to Kate and have her kind of fill you in on her research activities. So let's take the first slide here. This is the basic framework that we've put forward in the Community College and Public Health report, and it basically includes the following three components: the Public Health Foundations and core courses. Now these courses, this 9-credit sequence, or 3 courses, is the same as we've been advocating for the public health generalists and specializations. So that one of the nice features of this whole approach is that if a institution decides to have more than one of these, students can come in, take the public health foundations and core, and decide which direction they want to go. So that often, in addition, some of these courses, public health overview, health communications, personal health, with a population perspective, any of these are natural courses to use as general education introductory courses. So you may find that even before you're ready to go with the Health Navigator program, you may want to offer one or more of these kind of foundational courses, which not only serve the needs of public health programs, but will be of interest to other health professionals, nurses, allied health professionals, perhaps social service professionals, and a wide range of people who are just interested in understanding what public health is. So those are the common core. They can be used for general education, and they are built into both the Health Navigator group program as well as into the public health generalists and specializations. Then there are 12 credit hours that are specific to the Health Navigator programs, both to what we're going to talk about in a minute as the associate degree, but also in the academic certificate program. And what we've labeled them is prevention and community health, healthcare delivery, health insurance, and accessing and analyzing health information. And these are courses. All of these courses have content outlines in the Community College and Public Health report. In addition, we, as many of you know, we are putting together a guide, and that guide will have learning outcomes for all of these courses. So we hope to be able to make it easy for people who are developing the programs, at least to have a draft of course content and structures to fit into either an academic, either a associate degree program or an academic certificate program. Finally, we're recommending experiential learning, which is core to all of these programs, and electives. And the electives have a number of intentions. One is to allow flexibility because there are variations from state to state in the requirements and even the licensures that are going on with health navigation and related fields. So there's a need to have some flexibility on a state-by-state basis. But also, one of the directions, as you'll see in a few minutes, that is happening in this field is it's beginning to, the jobs are beginning to specialize, from HIV to cancer to diabetes, to a variety of different populations, the frail elderly, and so that it's useful in these programs to offer some elective courses to meet the needs of your local workforce. And I think doing that, not only is that good for the students, but I think that will help you gain approval for programs and meet local needs, not just national needs, as you design the programs. So I think the way to think about these programs is foundations and core, required courses, and then experiential learning and electives. Now, they're both, this program is designed as 30 credits. That means that it can be the total of an academic certificate program in many places, and alternatively, it can be a half of a associate degree program, and particularly an applied associate degree program, one in which people go immediately into the workforce. So the next slide talks about the different student audiences, and one of the challenges as well as one of the opportunities in this whole field is that there are so many different audiences and there are so many different job titles that you really, I think, need to think through your way through what is a bit of a maze, but a rapidly growing one. So let's just talk about some of the student audiences that are potential here. There's the associate degree students right out of high school who want a health career. And you'll find a number of people coming out of high school, but more often you'll see them coming into the more recognizable professions and maybe changing their mind or finding that this is a better direction for them. So associate degree students directly out of high school is certainly one audience. And as you'll see, as we talk about it later, the job market is quite suitable in terms of salary and opportunities for many of these students. Secondly, there will be some of these students who want to have not only applied degrees but transfer degrees into a bachelor's degree program. And one of the things we've worked out, we're still working on but isn't very promising, is the ability to transfer these degrees to health education specialization, which is a bachelor's degree program with a certifying examination, a chest exam at the end of the bachelor's degree. We had a whole session on health education specializations at the bachelor's degree level a few weeks ago, but clearly students coming in can either see this as an applied associate degree or an associate degree for transfer. Then we've looked at what kind of academic certificate programs. By that we mean, and we use the term 30 semester credit hours, even though that may not be exactly the way all the institutions are set up, but we think of it as half of an associate degree, an academic certificate program being half of an associate degree. And for many health professionals and social service professionals, becoming a health navigator is an excellent add-on. So nursing, allied health, social services degrees for students getting an associate degree in clinical applied fields, their job opportunities may greatly expand by having an add-on academic certificate program. Finally, we think there will be an increasing variety of academic certificates, interest in academic certificate programs from people who are already in the workforce. Those who are working in the field, those who have degrees in other fields, and those who are working or coming back to school for a variety of reasons. So these will be particularly, and they'll benefit by bringing their experience. This field has had a number of different kinds of people involved. Some of them are people like cancer survivors or people who've had experiences and success in overcoming drug abuse, and a variety of different kinds of people who have committed and worked in this area despite the fact that they don't have formal academic credentials. And increasingly these people are recognizing that and are looking to come back to school to gain some formal training and credentialing. So let me just look at the next slide. And one of the things that we want to give you a sense of is what the jobs look like and what's out there. First of all, I'm going to show you a variety of job titles in just a second. There are been over 120 job titles. Kate actually identified an enormous number of job titles that are able to that fit into this. But the way we look at it, there are three basic jobs that are overlapping and together subsume the field. One has traditionally been called community health worker, and there's a large number of people, as you'll see, that we have some data on the formal work title called community health worker. Then there are patient navigators, and sometimes called healthcare navigators, or a variety of other titles that I'll show you in a minute. And the third are health insurance navigators. This title, of course, came originally from the ACA, but is now becoming more widely used. So that all of these really represent the three basic areas of work in the community, in the healthcare delivery system, and in the health insurance system. And they're all really are navigators in the sense that they help people get through a complicated system. So let's take a look at some of the job titles that have been identified. It's really, this is a very coned down list from over 120 job titles. But you'll notice some things here. One is there are a whole variety of people called community health workers, community health advisors, community health navigators, community health associates, so that the community health aspect has a strong tradition here. Secondly, you'll see that healthcare navigators are certainly an entity, or patient care navigators. But in addition, many of the jobs are really quite specific. Asthma educator, diabetes educator. In addition, you'll see cancer navigators and other very specific kinds of health navigators, leading to the idea that it will be important as these programs develop to be able to provide that kind of specific education as well as the more general overviews. And finally, some of these jobs will be organized around the kind of population being served. Some of them will be Latinos, suggested here in Promotorias, and others will be Medicare navigators, which is certainly a big need in the elderly, Medicaid navigators, and so you'll see that certain kinds of jobs will be organized around the population to be served. So we, as you can see, the big challenge here is to figure out how does this all fit together. But the strategy that we took, because there are so many different job categories and job descriptions here, was to think of this field as needing three kinds of training: prevention and community health, healthcare delivery, and health insurance navigation. And most people who need these services, either the elderly, or the people who have complex diseases, or those who have low health literacy, all of these people often need all three of those services. So the distinction between those three are really quite artificial. And our contention is that a comprehensive preparation for health navigation education involves all three. So we'll be talking, as we think about this, about prevention and community health, patient navigation or healthcare delivery navigation, as well as health insurance navigation. Okay, in this scenario you may have some questions. We'll be glad to talk more about that as well. Now, why is this now on the national agenda? Well, this need has been here for a long time. We have the most complex healthcare system that you could imagine. It would be hard to imagine designing one that is much more complicated. And that complications are true for not only patients, but for healthcare providers as well. And that's been true for a number of years. But what's changed in the last few years is finally this is being recognized and the jobs are being paid. In the past, this began as an on-the-job training. It began as either low or no pay, but today these are increasingly paid jobs. And so let's start with go back to the Medicare 30-day rule. Going quickly through the slides here. When we go back to the...
I had a little problem with the slideshow, so
okay.
I apologize for that. Start over.
Well, let me just talk to you about the Medicare 30-day readmission rule, which is really one of the forces that is propelling the job market. In the past, Medicare has recognized that one of the big costs is that people will come into the hospital, they'll be taken care of often very well in the hospital, and then they'll be discharged and something will happen. And that something is their coordination of care, their follow-up care is really not very good. And they will end up back in the hospital within 30 days with the same diagnosis. And that's bad for everybody. It's bad for the patient, it's bad for the institutions in many ways, but it's certainly bad for the cost of health care. So Medicare came to the idea that there should be some penalties for 30-day readmissions. And over the last 2 years, and now increasingly, they are putting real financial teeth into that, and hospitals are really feeling the pinch of having to be sure that people are not admitted readmitted for the same diagnosis within 30 days. And the Hospital Association did a major consulting report and tried to say, well, what could they do about this? They certainly didn't want to lose this kind of money. And so they came up with a startling idea that they needed to have people who worked with people after discharge to be sure that they followed up, that they took their medicines, that they came back for their appointments, that they understood what was going on. They did all those things that we've classically said need to be done by health navigators. So suddenly the hospitals, where an awful lot of the money in healthcare is, have come to the recognition that it's in their self-interest to hire people to get this job done. And so they're hiring people directly, and this is a relatively new phenomenon. 2014 seemed to have been a turning point in all of this, and it's now beginning to really grow. And so I think you're going to, when you hear about the 30-day Medicare 30-day readmission rule, there's real money in that, and there are real jobs as a result of that. Next slide. Now, there's lots of things that have happened as a result of the Affordable Care Act, and buried within lots of the different provisions of the Affordable Care Act are incentives to have health navigation education. I often refer to them as health navigators, but as you see, there are lots of different names attached to it. So we can also refer to it as health navigation education. The Affordable Care Act directly and indirectly encourages health navigators, including the development of what is called accountable care organizations. This can be confusing because that's ACO as opposed to ACA. The accountable care organizations are organizations of healthcare providers in which they have a strong financial incentive to facilitate care, to make it efficient and effective, and if they save money in doing that, they keep a portion of it, so that the incentive system is beginning to really work. And when you hear accountable care organizations, you should be thinking about an organized care system that has every reason to use and hire health navigators. In addition, health navigators, there are some direct payments for health insurance navigators, which came out of the ACA, and also in the federally certified health centers serving approximately 20 million people now, there are specific jobs for health navigators that have been created and continue to be under the ACA. Next slide. In addition, Medicaid is an important source of use of health navigators. In recent years, Medicaid has allowed a state exemption process that allows a state to apply for an exemption to have clinicians be able to bill for the services of health navigation professionals. And so you'll see that that often now in a number of states, health that there'll be jobs under Medicaid serving poor populations, but with the expansion of the Medicaid under the ACA, this population is growing rapidly, and there are estimates that about 70 million people will be under Medicaid by the year 2020. So this Medicaid is becoming less of a poverty-limited program and is rapidly expanding in many states, and health navigators are increasingly being built into Medicaid. So the future is bright in terms of the big issue, which is, are there jobs out there? And so I want to spend a little more time talking to you about what do we know about where the jobs are, what do they pay, and what's the future of the job market. The good news is every indication is that things are growing. The bad news is we only have partial data. And that's because the Labor Department only tracks community health workers, and they represent probably today a minority of all of the jobs that are out there, but we really don't know the exact details. But we have quite good data on jobs called community health workers from the Employment Outlook of the Labor Department, and they expect at least a 21% increase in jobs called community health workers between 2012 and 2022. The patient navigators, and as I said, the other job titles are beginning to grow as well. So next slide. This gives you a sense of where the jobs are, and of course it doesn't take into account the size of the population, but you can see this is not a local phenomenon. This is clearly a national phenomenon, and you'd expect it to be a national phenomenon because the payment sources are national. Medicare, Medicaid, hospital reimbursement sources. So I think you're going to you'll see this become a national and not a local phenomena. Next slide. This one I think is important from the perspective of development of programs in community colleges, because it takes a look at the average annual mean wages, and despite the fact there's some variability based on the kind of the economics of different areas, you'll see that the range in 30 to 60 is the basic range. $30,000 to $60,000 a year is the basic range of salaries for community health workers, and so that fits. People have certainly said that they thought this fit quite well with the kind of expectations that would be for an associate degree graduate. So this hopefully is one of the things about these programs is that we have every reason to think that these can become owned and operated by the community colleges. These can become degrees that really are designed by and serve the missions of community colleges. In addition, the percentage growth you'll see is really quite, with a few except outliers, the growth looks quite uniform across the country. And so that, again, once again, I think you're going to see this to be a national phenomena, which means that you will be serving a national as well as a local audience when you train people. But if you'll notice that 20 to 30% growth is certainly the norm across the country. And then the final slide gives you a detailed look at at the employment base. On the national average during these years is an 11% increase in all occupations. They actually indicate a 25% community health worker employment increase between those years. A number of things to look at in this complicated slide. One is there's growth in all the categories, and quite substantial growth in all the categories. But there are a few areas where there is especially large growth. One is the ambulatory, the outpatient services, the ambulatory health services, and then the home health services. I think one of this is telling you is that the kind of the places where people are going to be working, even though they may be employed by a hospital, they're going to be working in an outpatient setting. They're going to be working in offices. They're going to be working at least out of offices. They're going to be working in the community. They're going to be coming to people's homes. They're going to be really very much of a hands-on, in touch with people. So I think increasingly this is going to be very much of a profession for people-oriented individuals who really want a profession that they can provide service. In addition, you'll notice that under the social assistance area, there are large areas of growth, and the most dramatic, 68%, is the elderly and persons with disabilities. One of the things that's becoming very clear is that we spend an enormous amount of money on Medicare and on elderly care in general, and we don't always get the full benefit of it. And part of it is that our system is so complex, and elderly people have a great deal of difficulty getting through the system, and there's lots of potential to not only save money but to improve the quality of care. So now that our system is focusing on those kind of issues, I think you'll see that the Health Navigator education is a logical way to help make that possible. And the community colleges are certainly positioned to do that because these are kinds of professions that have a great deal of overlap with nursing, allied health professions. So the community colleges that already have a base in the health professions and the social service professions are really quite well set up to develop these programs. So that's a quick overview of what we are recommending as academic programs and some of the job potentials that are out there in terms of that. I'd like to turn this over to Kate Johnson, who I'm very pleased to say is a graduate of our program in health policy at George Washington, and both Cynthia and I were members of her dissertation committee, and she did a wonderful dissertation looking at community colleges and Health Navigator education. So I will turn it over to Kate and take it from there.
Well, thank you. I'm very happy to be here today as well. And please, either of you, feel free to interrupt me at any time if you want to add things, because as Dick was just saying, both he and Cynthia were very much involved in this project as well, and I value their input as well. So I'm going to try quickly. It looks like, Cynthia, I'm able to advance the slides, so I'll just go on with this. So my dissertation was really trying to get a handle of what community colleges are currently doing. We know that this is a growing field. There's lots of potential. We know anecdotally that a lot of community colleges, or at least a certain number of them, already do offer training for community health workers, patient navigators, all these other job titles that we've been talking about today. But I was just hoping to get a better understanding of what is the current state of practice at community colleges, where are these programs being offered and what do they look like, and then how do colleges experience these programs? What are their successes and challenges, or barriers and facilitators in terms of creating enduring programs around Health Navigator education that can be successful for the college and the students and the communities? And then thirdly, looking more specifically at this community interface question, and how can these programs, as they're being established, really create effective relationships with the local communities in terms of internship experiences, in terms of having jobs for students when they complete the programs, and so on, having a positive benefit in the community. So I have a number of slides here that kind of outline the methods of this project that I'll kind of graze over rather quickly, but these are just here for your reference. Of course, the League was very much involved in helping me achieve this project and access the community colleges and that sort of thing. So the survey I'm going to be talking about was administrated through them, so I'm very grateful for their assistance. But basically there were two components of this project. One was this online survey that was trying to get a grasp of what sort of programs are currently being offered as community colleges, as I mentioned. And then secondly, reaching out specifically to colleges that currently have some form of program that falls under this general rubric of Health Navigator education, and really learning from them through interviews how it's going, how they made the choices they did, and what sort of advice may they have for other institutions who are seeking that path. So I'll start with actually discussing the interviews. It was a very small sample. It's not easy to find colleges out there that do have programs that kind of met the requirements that we were looking for in terms of including in this project. But I ended up, when all was said and done, talking to 11 colleges around the country. Depending on the college, it would be anywhere from just one person who really was in charge of all aspects pertaining to the program, to, in some places, 2 or 3 or 4, based on the number of active faculty or administrators who are involved in administering the program. So these were phone-based interviews, and then that was supplemented with document review and that sort of thing. And I really was looking for themes. This was an applied research project, so I was just looking at what are they telling me, and how can I package this in an effective way that external audiences might most benefit from. On the quantitative side of the house, that was an online internet-based survey that was sent out under the auspices of the League. We sent out about 900 invitations, and just under about a third of those that were invited actually participated in the survey. We had a response rate of 29%. And then we did do pretty extensive efforts to follow up with those who didn't respond, just to see what else we could learn from those who didn't take the online survey but met our inclusion criteria. And the goal with the online survey was not just to target institutions that currently have some form of Health Navigator education, but all institutions that have some form of allied health or related programs that may be a good domain for wanting such a program in the future. So any community college with health-related, allied health type programs, we were trying to target the administrative leadership to just get their opinions about this framework that Dick introduced and how they might experience or feel about adding Health Navigator education to their curricula. So this was conducted last fall, and the survey was open for about a month, and we did do all we could to make the response rate as high as we could through follow-up emails and invitations and these sorts of things, which we can talk about more later if you'd like. Okay, so now in terms of the data itself, regarding that first question about what is the current state of practice at community colleges. Out of those who responded to the survey, only 13% indicated that their institutions offer some form of existing programs for Health Navigator education. Now, I want to say right away that when I'm using this term Health Navigator education as an umbrella term, but we asked very specifically for them to identify, as I'll talk about in a minute, all the sorts of professions or academic areas that may fall under this general umbrella we've been talking about today. So that could include anything from a community health worker certificate program in a state that has specific legislation for community health worker job titles, to more broad kind of public health programs that are seeking to train for more than one of these areas within Health Navigator education. But if we look at across that spectrum, about 13% of the colleges indicated that they have some form of existing program. As you can see in the table here, the majority of them included an academic certificate. So colleges, respondents could check as many of these as they wanted. So some colleges have all 4 of these categories, but you can see most of them, or at least the greatest number, responded that they at least have an academic certificate, and then a slightly smaller number, just under half, said that they have an applied associate degree, and then it goes on from there. And on the qualitative side of the house, I'm going to be kind of sharing the results from both the interviews as well as the online survey. Why such an emphasis on certificates? Well, the main answer was, and I'm sure this isn't surprising to most of you, is that certificates provide so much flexibility. As we know, this can be a really important stepping stone for non-traditional students of all walks, whether it's someone who's just trying to figure out how to find a path of service, to maybe has difficult work-life situations, to someone who's already an active professional in the allied health or health services arenas, public health, etc., that sees this as a value added for them. So the benefit of a certificate, of course, is that it can build into a more formal 2-year, even 4-year degree, but it's a tangible way to kind of make progress while keeping your options open. So what I was hearing from the colleges that currently have programs is they really do see a range of students. It's not just either struggling students who, are maybe trying to find their first step forward into an area that they're passionate about, nor is it all, working professionals. And it's also traditional students who just see this as a, logical way to start a career in public health or allied health. Okay, in terms of the specific job titles, which these existing programs out there see themselves as training for. As I mentioned, this was a very small amount, only 13% of the respondents indicated that they had programs currently, but out of those 13% who said, yes, we have a program, we asked them what sort of job titles do they envision their program graduates finding. And community health worker was definitely the most commonly reported job title. Again, they could check as many as were relevant, but you'll see kind of in descending order here other job titles that these programs felt that their program, that their Health Navigator program could train for. So you see right at the top there as well, this whole area of patient navigation or healthcare navigation was reported by half of the respondents. And then under here you'll see a smattering of other less commonly reported job titles. Many of these could fall under they may be a community health worker, but in a border state who prefers to call them promotores, or they may be a health insurance navigator working in a healthcare setting. Again, these are very overlapping titles, but we just wanted to see how do these colleges that currently have programs envision themselves in training graduates for specific professions. And then this bottom part of the table, I know it's a little bit confusing, but just because it does come up, we were interested in learning if these programs see the wealth of titles as a benefit in which they want to be involved in as many as possible, or whether they see it as kind of focusing on a specific domain within health navigation, such as prevention and community health or healthcare navigation. So this wasn't a preference question, but all we did here in this bottom part of the table was see how many institutions responded to healthcare navigator, patient navigator, but not community health worker or vice versa. So just under half of the programs said that they really only train for community health workers, and their programs don't include any content. They don't see them as also preparing healthcare navigators. But you can see that almost 30% of the programs saw themselves as training for both healthcare settings and prevention and community health or traditional CHW settings. So just a little, we just thought it was sort of interesting. Whatever it does or doesn't suggest, that's what we found. This is also very interesting. We asked those that indicated that they currently have programs at their colleges how long those programs have been in existence. And as you can see, as of last fall when this survey was conducted, the majority indicated that they were under a year old. Whether they focus on training community health workers, healthcare navigators, or both, there were a lot of programs that were very, very young. You can see it kind of levels out, and there are some programs that have a lot of field experience as well, indicating that they've been around for more than 10 years. But again, this was a very small sample, but it does show a very prominent jump in terms of new programs being developed around the fields of Health Navigator education. We were also interested in learning about this whole community interface. Are experiential learning opportunities embedded in the program, and if so, where do those take place? About 3/4 of respondents indicated that their programs do have an experiential learning component. And in terms of where those internship experiences take place, again, it's really a range. The most commonly reported response is toward the bottom here, where it says community health centers and community-based nonprofits. A lot of respondents indicated that they were able to place their students there for internships. But you can also see a lot of other settings being used. 60% of respondents reported that they have students placed at hospitals. Then we see local government. This could be social service institutions. There really wasn't the capacity in the survey to zero down further, but a local health department, local social service institutions, and so on. And then also even insurance companies or working at the state level or in other settings. And we also asked them, how do these employers that host interns react when you approach them about potential possibilities for hiring graduates? Because of course we know that that's also a real goal of this program, is to make sure that the graduates thereof, those that aren't already in the profession or go on for more academic training, have a job available. And an overwhelming majority of respondents said that those internship sites are actively interested in having a longer-term collaboration with the community college program and potentially hiring some of those graduates. You can see 94% of respondents indicated that those internships that host, those sites that host internship students also were interested in potentially hiring graduates. So that's very promising. Now, one of the interesting questions here is, okay, so we see a predominance of academic certificates, and we see a tendency to having programs that the most commonly reported program model was a traditional CHW training program that focuses on that. But interestingly enough, when we started asking about how do you see this framework that was developed by the community colleges and public health projects in terms of these 3 core content areas and types of training programs, whether it's a certificate program versus a 2-year program, we hear a slightly different message. 68% of respondents across the survey, not just those that I've been talking about that currently have existing Health Navigator programs, but all respondents to the survey, out of that larger pool, 68% indicated that they would be most interested in an applied associate program model. And 3/4 of respondents indicated that they wanted to train for all 3 content areas. Now the next slide makes this a little more clear. You can see the question here. But we were asking on a number of indicators, how would this increase or not increase your interest in offering the Health Navigator framework? And if you look about halfway down the slide, we asked what if it focused only on community health or traditional CHW core competencies? What if it focused only on healthcare delivery settings? What if it focused only on health insurance settings? And you can see kind of a range of responses there. But when we ask if it includes all 3 content areas around community health, healthcare delivery, and health insurance, that's where we get 75% of respondents saying that they would be much more interested to include all those, and that would increase their interest greatly in offering the framework. We also asked about program model. You can see questions here about applied associate's degree, associate of arts degrees for transfer, academic credit-based certificates or non-credit certificates. You can see a range of responses here. There was the most enthusiasm around applied associate's degrees, followed by the associate degrees for transfer and academic certificates. Not a lot of interest around non-credit certificates. We also asked about online learning. Not surprisingly, this is something that comes up in all areas of study, not just around public health and health navigation education, but certainly there's also an interest in opportunities for online learning. 62% of respondents indicated that having such an element would increase their interest in offering the Health Navigator framework. Okay, in terms of those colleges and through the interview process, what sort of key themes came out about making these programs successful or not so successful? In terms of creating successful programs, I'm sure again this is pretty common in the community college context, and this won't be too much of a surprise of you, but the biggest strengths or the biggest factors that were likely to make a Health Navigator program at a community college successful were being able to establish these local connections with local employers, having internship sites, and having program staff, instructors who have these connections in the community already. most of the interviews I conducted, their program staff that were teaching these courses or administering these programs were already working in the field professionally and had a wealth of connections available to them that they were able to bring into the classroom, not just for the benefit of student learning, but also for the benefit of student learning outside the classroom in terms of facilitating opportunities for internships and potentially working with local organizations on job opportunities and so on. In terms of the challenges that those interviewees described in terms of things that were difficult for them in terms of setting up Health Navigator programs and making them be successful, one question was the salary question. Now, we've talked about that a little bit already today. It really varies depending on your local context, what sort of options are available for employers and what sorts of salaries they may be offering. Some people I spoke with on interviews indicated that in their areas they didn't think necessarily that a 2-year degree was justifiable if you look at the local job market, that they were having success with certificate programs because employers, it was a quick thing that an employer could support in terms of making their employees, usually existing employees, more successful, but they didn't feel like there was enough growth yet locally to support a full applied associate degree. So, you know, you just have to kind of look locally, see what the situation is. That was not the resounding message I got across the interviews. A lot of them said that they had a lot of success in placing individuals in the community for jobs and having good salaries. So again, it's just a question of where you are locally and just making sure you're aware of those situations. But in those cases, you may want to start with a certificate program and then just take it from there, whether or not it makes sense to build it into a 2-year degree or not. And the other question that is either a barrier or a strength, depending on how you look at it, is this question of state-specific certification. A small but growing number of states in the U.S. have existing legislation around the certification of community health workers. Such Minnesota is one example, Texas is another example, where it may be in the benefit of students who want a profession in this area to align themselves with that and just to expand their career opportunities, for instance. And so it's really important that community colleges that are in those contexts are aware of the state context, just as you would be for any other program, and align their program with it to make sure it meets whatever state-specific needs may already be in place. And that can be supplemented by whatever you choose to do to make your program the best. So just to get back to this kind of diversity of responses that I got, I was talking that some folks said that, you know, they felt that really the local job market didn't support the necessity of a whole 2-year program and that a certificate level degree or certificate better met the job expectations. I also had respondents say things to me like the job market requires an associate degree. So again, it all gets back to local context. And regarding the second issue of state-specific norms or certification, here was one individual who was describing about that they didn't have a lot of flexibility in terms of changing, obviously, the state credentialing, but that they could still make their program a value added for students by doing it in other ways, making sure it was credit-based, making sure, instead of just a non-credit program on the side, making sure that it rolled in a seamless way to 2-year degrees, these sorts of things. So again, just being aware of the state and local context and how you can turn those into strengths for the program that you may be developing. And finally, in terms of developing employer relationships, again, this is true across many of the career and technical fields. But the resounding message from those programs that already have successful Health Navigator training programs at their colleges was that it all comes down to these relationships, and that the best way to be successful in maintaining them is really to hire good folks. Have instructors, faculty and staff, administrators, whoever it is who's working in this program, that either come in with that professional background or have the time in their new job to go out and actively build relationships. It's really key. And also piggybacking on other programs at the community college already where you are. So some institutions talked about building on internship programs that were already in existence for nursing or nursing assistant programs. for paramedics, because we know that community paramedicine is a growing area for health navigators, community health workers, those sorts of job titles. So building on the connections that already existed through, say, a paramedic program, or other sorts of social service programs that are in place and that are embedded in the community that are already being administered at the community college. And then finally, really being keyed in and attuned to those state and local workforce environment. As I mentioned, some states are quite advanced and have state workforce groups that can help funnel job opportunities, that can help articulate policy changes and all sorts of things that may impact the program and the administration of the program at the community college, and also the students' experience in that profession going forward. So it's a great resource for the college and those that are working and administering and teaching in the program, but also for students as they graduate and are seeking career opportunities, and just to have this professional cohort that they can turn to for support, guidance, and so on. And really, in terms of the challenges with affecting successful employer relationships, it really comes down to a lack of effort. Either not having program staff who have the time or the ability to be actively following up with the connections in the community, and then maintaining those relationships in the long run. It's a lot of work, and it shouldn't be underestimated, you know, the effort that it takes to keep those relationships well-oiled. If you look at this slide of quotations, the second one says, "The key is visiting sites as often as you can and maintaining contact even when you don't have students there for internships, because otherwise they kind of forget about you." So one of the things that really came through with the interviews was that it's really great to, and employers are really interested in collaborating with community colleges in these programs, but it's an active relationship that needs to be maintained, whether or not there's a student intern placed there currently, and that the person who's serving in that role, you know, it's going to take some time on their part to be proactive about forging these bonds and maintaining them. So just based on everything you've been hearing, I have just a couple, two slides of kind of basic recommendations here that sort of summarize everything I've been saying that came through both through the interviews and the online survey. And this one I won't say it again, but just the value of having program staff who are going to be very effective in maintaining those connections. Also becoming familiar with the existing literature on community health workers, patient navigators, all those other job titles out there. Because there is often, the interviewees cited that they bring with them a lot of statistics and facts and information from the literature that's really compelling when they're approaching employers for a potential internship or future job opportunities for their students. How quickly that a little bit of support at the front end in terms of training a student can help them develop more cost-effective strategies in the administration of their organization. So actually being aware of this literature out there and how to use it with community was something that also came through this research. Obviously seeking input for the state and locals, not only in the development of the program, but in the program name itself. This is a little bit of a sticky question in some contexts, so just make sure that your local stakeholders are your allies in terms of deciding how to name your program. It seems kind of basic, but whether you frame your program as something that's training across these three areas of health insurance, healthcare navigation, community health, or whether you prefer your program to be very specifically oriented around, say, healthcare navigation, or CHW training, whatever it is, just to be cognizant that the folks in the community are going to react to something as basic as the program name, let alone the graduates who come out of it. So just to keep them involved in that process. And these last two recommendations we haven't talked quite so much about today yet, but one is in terms of recruiting students. One of the hallmarks of a successful program is to have students enroll in the program and graduate. One of the things that came out from my interviews was the value in really recruiting students from the communities that these programs seek to serve. So by that I mean, we were talking earlier, Dick was talking about how people are coming to this profession from all walks of life. Maybe they've had an experience with cancer and now they're passionate about helping others be successful in navigating that process. Maybe they're coming from an underserved community and they've grown up in a context where they see the lack of services and public health benefits for their community, so they want to be involved in helping their community really connect and thrive. Maybe they're already embedded in a healthcare context and they see this as a value added. So however you seek to train your program, you train your students and have them work in the community, look there for students in terms of advertising the program, in terms of building connections, gaining trust, bringing attention and interest toward your program. And finally, as you look for the funding of your program, one of the other things I wasn't expecting to hear but that came out was a lot of the colleges that currently have programs have been successful in seeking funding, both from private organizations as well as public funding opportunities, by collaborating with the local stakeholders. So there's a strong argument, as we've already heard today, around the benefit of having a health navigator in your community. And you can best articulate that when it's not just you saying that, but it's also your local employers and other local stakeholders who are agreeing with you in that. So seeking those collaborative partnerships for the design of the program and the ability to have internship sites and employment sites for your future graduates, but also in terms of thinking systematically about the long-term sustainability of the program and building essentially a model community, right, that you can articulate to a funder and say, look what we've got here, look what it's doing for our community, and use that as a way to seek funding opportunities. So some of the programs mentioned having some basic articulation documents ready and waiting for when those funding opportunities came along, they had them ready to just, essentially stick in the mail. So that was a very quick overview, briefly some of the main things that came out from this research. Thanks for listening, and I'll turn it back over to Cynthia.
Well, thank you, Kate, and we really appreciate all of the work that you did for the project and in exploring all these various aspects of what programs are out there and what the jobs are, and what's happening in the field, and really good research for us to use as we're going forward and as we've been working on the project. Dick, did you have any other comments that you wanted to make?
Well, I think I'd love to get questions from the audience, and we may not be able to answer them all today, but if you get them, we would certainly be glad to do that over email or perhaps at the next session as well. But hopefully you have some questions that this generated.
We do have some questions. I'm just trying to kind of bring them up. Oh, here they are. Yeah, there's a question that says, why would a state such as Michigan have 0% growth for community health workers? Is no Medicaid expansion expected?
Yeah, I think some of those are no data. I think that the ones that are in white, I think, are where there's no data as opposed to no growth. I think you're going to see growth across the board because the funding sources are national. Though I would assume that a state that has bought into the Medicaid expansion will see greater growth than ones that haven't. But that's not uniform. One of the states that has had enormous growth in community health workers is Texas, which, as you probably know, has not been accepted the Medicaid expansion.
Okay, then another question: are there accepted faculty credentials for the Health Navigator curriculum? That's a question that comes up quite often about the faculty credentials.
That's a to be determined question still. We certainly think that people who are doing these courses need to be familiar with the component that they're teaching. And so somebody who has worked in the healthcare system extensively with a master's degree perhaps is a good candidate for teaching the healthcare delivery system. But it's not just because you are a clinician that qualifies you to understand the breadth of the healthcare delivery system. So be sure you identify people who really have that broad view. The health insurance type coursework does require a different kind of person, and the health insurance system is very complicated in the United States, and you need people who have the content knowledge. So I would look for people who have content knowledge and not just people who have degrees, because in many cases their degrees will not really help them reach the content and the student audiences that you're going to have in these courses.
Okay.
Yeah, and just to add that in terms of the interviews, when I spoke with folks, it was across the board. But I just want to add the note that those states that have some form of existing legislation around community health workers specifically are also likely to have included in that legislation requirements for the instructors. So in the state of Texas, for instance, I believe it's just a simple CHW instructor course that the instructor selected by the college also has to go through. But just to be aware that there might be some of that mandated from above.
Okay. Then just a couple of comments with a question embedded. I'm a bit disappointed to see in the report a requirement that instructors hold master's degrees. Am I reading that correctly? And the same person concerned that higher ed may be a barrier to attracting a diverse group, but yay for content knowledge.
Yeah. If you're talking about the Community College and Public Health report, the only place that was specified was in the health education specific coursework. And that comes out of the fact that these courses lead to the eligibility for the chess examination. So there are some regulations that kind of surround that eligibility. But I would not regard these courses as being different from your average community college course, where you have some restrictions on the degree requirements, but that those are really institution-based requirements and not necessarily profession-based.
Okay. Do we have any other questions? I know we're right at our time, a minute or two over, and want to be aware that people have other things going on. So, but if it doesn't look like we have any other questions coming up, but if you have any other questions, please feel free to send them to me and to Dick. We'll be happy to get answers back to you. And as with all of the webinars, we are making them available. If you're the last two that we've done plus this one will be put on the website within the next few days. But if you need it before then or any of these before then, just let me know and we can get them to you. We've got a way to do that, so you can view them or even download them yourself if you'll let me know. But I want to thank Dick and Kate again for their presentation, and we're getting some other little question in the comments section now just saying thanks, so thank you for that. And we have, again, the second part of our health navigation webinar series is next week at the same time, and we'll have our presenters are people from a community college health navigator program, so that I think they've got quite a bit to offer, so hope to have you all back next week. And again, thank you so much, Dick and Kate.
Thank you all.
Thank you.
Okay.